Madam Clerk.
Oral questions by members.
Opposition House Leader.
Well, thank you, Mr. Speaker. I think it's a well-established fact that British Columbia has the highest gas taxes and the highest gas prices in all of North America. And as gas prices continue to skyrocket, the NDP government is raking in record fuel and carbon taxes without providing any relief for BC's families. Now, despite years of empty promises, the Premier continues to shrug his shoulders and do nothing. But, Mr. Speaker, there is one thing that the Premier could do. One step that he could take would be to return some of the millions of dollars in gas taxes that his government is receiving. He could return some of that to British Columbians through a one-time carbon tax rebate to help lower and middle-income British Columbians. So the question to the Premier is this: will the Premier take this action to help families who are struggling with these skyrocketing gas prices?
Minister of Energy and Mines.
British Columbia is not alone in facing higher gas prices right across the country, from St. John's to Winnipeg to Toronto and here in British Columbia, and indeed around the world. The war has had a huge impact on world prices, and just yesterday, President Biden, the United States, has decided to end imports of Russian oil and gas, which will have further upward pressure on prices around the world. The federal minister here in Canada, the Minister of Industry, has called upon the Competition Bureau to protect Canadians against possible gouging. And unlike the opposition, we believe gas companies should be accountable for markups and price hikes. We brought in the Fuel Price Transparency Act to force the companies to come clean, and the members chuckle. That's something that they certainly never did in their 16 years. Well, let's just get to it. Their newly elected leader said in 2008, "I don't want to pretend there's any magic solution to the fact fuel prices have doubled in the past 12 months." And he was asked about this question just yesterday, 14 years later, some time to reflect on what he might do, I suppose. And his answer was, "Yes, this is what I said, and it's true." So you guys got nothing. You got nothing.
Opposition House Leader supplemental.
Wow.
Members.
British Columbians aren't laughing.
Look at the shiny object. I mean, get serious, Mr. Speaker. Get serious. You know who's not going to have much of anything left if this government doesn't take action is British Columbians, who are dealing with these soaring gas prices, and the government's sitting around shrugging. You know, every time this government mentions Kevin Falcon, you know what goes through our minds? Call the by-election. Call the by-election so he can sit right here and you can have the exchange with him in person. When Kevin Falcon was in government, he brought in the revenue-neutral carbon tax, which actually offset carbon tax. A revenue-neutral carbon tax. Imagine that.
Members.
Imagine that. Imagine taking carbon tax revenues and offsetting that with personal income tax reductions and small business tax reductions and all kinds of credits and rebates. You know,
members, let's listen to the question, please.
Home renovation tax credit, things like that. What's one of the first things this government did? They ended the revenue neutrality of the carbon tax. The NDP are, in fact, with these soaring gas prices, the NDP are actually raking in billions and billions of dollars of extra carbon tax that they're taking right out of the pockets of British Columbians. Families are being hurt by these high prices, these high gas prices, and they deserve some relief from this government. one tool, one mechanism that's available to this government, which we're suggesting here today, would not serve to put additional profits into the pockets of gas companies. This government could use the BC Climate Action Tax Credit, a tool that Kevin Falcon and the BC Liberals created. He could provide, the government could provide a one-time enhanced rebate,
Members,
a
let's
one-time
hear
enhanced
the
rebate
question.
that could be implemented in time for the next payment in April. The government could do that, and that would provide relief to British Columbians immediately. So the question to the Premier is this: will he implement this measure? Will he implement this measure or any other measure that would serve to actually offset these soaring gas prices to help British Columbia struggling families?
Minister of Energy and Mines.
Thank you, Mr. Speaker. Well, the member for the opposition misreads the history of the carbon tax. It wasn't revenue neutral for British Columbians. In fact, it gave over $2 billion to some of the largest corporations in the province. And the fact is, and I want to quote
Members.
a professor at UBC, Werner Antweiler, the problem is we have a situation in the global market and no amount of changes to taxes will make that go away. Increasing the carbon tax as planned in April by 1 cent a litre pales in comparison to the 20 to 30 cents a litre. That is essentially the Putin tax that's coming from the invasion of Ukraine by Russia. And the
Members, come to order. Minister, continue, please.
Thank you. Sorry, I was somewhat distracted by that braying from the other side. Alberta announced a 13-cent measure. At the same time, the price of gas in Lethbridge after that announcement increased by 14.5%, proving the point that I just made.
Member for Kamloops North Thompson.
Thank you, Mr. Speaker. Perhaps the Energy Minister is unaware, but the Alberta 13-cent rebate does not take effect till April 1st. Hasn't even taken effect yet. But again, Mr. Speaker, it's revisionist history at its finest with this government, because if you look at the budget and fiscal plan 2017-18 to 2019-2020, when there was still clear and concise, transparent reporting happening on page 66 on the carbon tax reporting plan, very clearly shows low-income climate action tax credit per adult, reduction of 5% for the first two income tax rates, northern and rural home owner benefit for up to $200, and the list goes on and on and on how carbon tax is actually refunded back to people in a way to actually help their affordability. And they certainly seem infatuated with Kevin Falcon, and I do hope they actually would call a by-election so they could see him in person in this room. Because in 2008, they like to quote 2008, so let's look at what the Premier had to say in this chamber in 2008 when gas was going up. You know what the Premier was advocating for? A cap of 2.5 cents of carbon tax per litre of gas. April 1st, this Premier is going to be charging over 11 cents a litre for carbon tax. He likes to talk about having options, this Premier. The Premier likes to talk about having options, yet he doesn't tell us what those options actually are. 207 weeks now, he has told this chamber he has a plan to lower gas prices. With a stroke of a pen, the Premier could help families with a one-time enhanced carbon tax rebate. Will this Premier finally act on his words and deliver the relief that people are looking for through an enhanced carbon tax rebate check?
Minister for Energy and Mines. Minister.
Thank you, Mr. Speaker. The carbon tax is a tax that's supported by the BC Business Council, The Clean BC plan has a program which the industry participates in, and it returns the carbon tax to those companies who achieve global standard of carbon emission reductions. So I'm not sure whether what the opposition is saying is that they want to reduce the amount of carbon tax available for reducing emissions here in British Columbia. Is that what they're saying? Is that their policy?
Member for Kamloops North Thompson, supplemental.
Thank you, Mr. Speaker. Well, the minister seems to, and I guess it's not surprising, they've ignored their own advice in their budget book about taxes hurting low and mid-income families in their budget. But the reality is BC has the highest gas prices and the highest gas taxes in North America. And we're about 50 cents a litre currently more expensive than Alberta, right next door to us. And last I checked, the war in Ukraine is impacting Alberta just like it is BC, but it's 50 cents a litre less in Alberta. The Climate Action Tax Credit, which was created by Kevin Falcon and the BC Liberals, it was specifically designed as a tool to refund carbon taxes to families. The NDP's, one of their first acts was to remove the revenue neutrality of carbon taxes, and now they are raking in well over $1 billion a year in extra carbon taxes. No one knows where it's all going. Again, the
Members,
Premier
let's hear
has
the question,
repeatedly
please.
promised action on gas prices. Why will the Premier not use a very clear tool to get money back in the pockets of British Columbians to try to help them with their increased fuel costs in their daily lives?
Minister of Energy and Mines.
Mr. Speaker, it's disappointing to hear the member opposite, perhaps not surprising, to argue against a measure, the carbon tax, that is proven to reduce emissions and funds investment in low-carbon innovation. The suggestion
Members, order. Minister will continue.
The suggestion is that it was revenue neutral. They weren't able to explain it back in 2008, and they're not doing any better job 15 years later. They gave over $2 billion to the biggest corporations in the province. That was their version of revenue neutrality.
Thank you. Leader of the third party.
Thank you, Honourable Speaker. My colleague and I have been asking the Minister of Health about the corporate delivery of health care in our province and raised our concerns about fees that are being charged to patients. So far, we haven't gotten clear or direct answers, so I'll try again. My question through you, Honourable Speaker, is to the Minister of Health. Does the Minister think that healthcare delivery by a for-profit telecommunications company that generates dividends to shareholders is aligned with the spirit of universal, equitable public health care?
Minister of Health.
Thank you. Well, thank you, Honourable Speaker. And for the last several years, we've repeatedly taken action to strengthen our public health care system. The member knows this. That action has affected the delivery of care to seniors, primary care, every aspect of our healthcare system, and it's involved improving services for people in terms of their wait time and their access to services. It's why we purchased and brought back into the public system MRI machines. With respect to the question of the honourable member, what has happened is, and what's happening now, is consistent with the rule of law in BC. The Medical Services Commission is reviewing those questions. They started to do that in February to review and to ensure that everyone in BC is acting in compliance with the Medicare Protection Act. We took measures, as the member knows, in 2018 to bring in regulations that have been passed by the previous government but not brought into force. We brought those regulations into force. We'll always defend public health care, and we're doing it now.
Hear, hear.
Leader of the third party, supplemental.
Thank you, Honourable Speaker. We've looked into the healthcare services that are provided by TELUS, and there are a few different programs available. Virtual care is covered by MSP, and patients access a virtual walk-in clinic. Doctors can prescribe medications, write a requisition, give advice, but no longitudinal care. My Care, also covered by MSP, offers in-person appointments as needed, determined by a virtual screening process. For a $1,000 fee, patients can access annual screening. And then there's Life Plus. Life Plus offers in-person medical office visits with access to team-based care like we have come to expect from a family clinic. The annual cost of enrollment in Life Plus is $4,000 for the first year and $3,000 for every year after. My question is to the Minister of Health. When a for-profit telecommunications corporation charges patients thousands of dollars for what amounts to access to a family doctor, is this in line with what the Minister considers to be universal, public, equitable health care?
Minister of Health.
Honourable Speaker, the Medicare Protection Act protects our public health care system in BC, just as the Canada Health Act protects it in Canada. It's not an issue of amounting to. It's an issue of ensuring that medically necessary care is available to all British Columbians, regardless of income. And this is, Honourable Speaker, been the basis of the system. If the members are saying, because this has been the development of public health care in Canada, that it has been defined and provided often by private corporations, including family doctors, effectively that, with public pay. That is our public insurance system in Canada. And it has worked for us well. It requires improvement. It's why we've invested in 56 primary care networks, 28 urgent and primary care centers, delivered team-based care, added community health centers, delivered by nonprofit providers in this province, and will continue to support public health care for everyone in BC.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Yesterday, the Premier finally agreed to activate the Select Standing Committee on Health to work across party lines on the opioid crisis in our province. This is an opportunity for collaboration between all parties on a crisis that is killing nearly 7 British Columbians a day. Critically important will be to build on the work that has been done, specifically following the blueprint of the death review panel that was released. This report is the work of 23 public health experts who have provided urgent recommendations with very specific timelines. So today, the Premier has had some time to review the report. Will he now stand and accept the recommendations and timelines for immediate action?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The Premier announced yesterday that we'll be developing terms of reference for the committee, and I look forward to developing those terms of reference in cooperation with the Premier and his office, and I look forward to hearing the opposition members' ideas on how we can work together to fight the overdose crisis and save lives.
Leader of the Official Opposition, supplemental.
Well, thank you. And as I said earlier, we appreciate the fact the Premier finally said that he would activate a committee that could have been activated months ago, as continuously we heard story after story of people losing their lives in British Columbia to this crisis. That minister's answer means nothing when it comes to the recommendations that have been provided. They are specific timelines, specific recommendations. The death panel review provided specific and deadlines from April 11th through to September. And the report itself said that this government has not acted with the urgency that is required. And in fact, what did this minister do yesterday? Within hours of receiving the report, the minister, despite the fact that a panel of experts brought the recommendations forward, said, and I quote, "We already know that the 30, 60, 90-day time frame just doesn't work," end quote. Within hours of the recommendations brought forward, the minister simply dismissed it. Actually, what we do know, we know, and it was confirmed in the report, that this government's approach is not working. 7 people a day are dying in our province. What could possibly make the Premier hesitate and today the non-answer by the minister, why wouldn't she stand today and say, of course we accept the recommendations, we are going to move to meet those timelines, and in fact this review panel will form the basis of the work done by the Standing Committee on Health.
Minister.
Thank you, Mr. Speaker. Our government has been acting urgently since 2017. We have evolved our response to the terrible loss of life and the increasing toxicity of the drug supply. Every year since 2017, since the beginning of the forming of this ministry, we agree with the policy directions that were identified in yesterday's death panel review report. And they align with the work that we've committed to and that we have underway. Expanding prescribed safe supply, expanding the treatment and recovery system, expanding drug testing, and the oversight and accountability of the treatment and recovery sector, in addition to the other work that we're doing to decriminalize people who use drugs, to expand supervised consumption sites, adding inhalation sites, as the method of consumption of drugs has changed and the drug profile and the terrible toxicity has expanded. And as I said yesterday, we'll work with our ministry to identify where we can meet the timelines that are recommended by the panel. And at the same time, we'll say we're not going to give people suffering on the loss of loved ones any false confidence about work that we've been trying to implement and expanding and amending every week that's been over the last year and a half, that a 30-day timeline or a 60-day timeline is realistic. We won't give anybody in the province false hope. We'll work as fast as we can, as we have from day one.
Leader of the Official Opposition.
What families in British Columbia who've lost loved ones need is this minister, instead of dismissing out of hand an expectation around 30, 60, and 90 days created by a panel of experts, instead of dismissing it, she should stand up in this House and tell British Columbians that we are going to do absolutely everything possible to make it work, to meet those deadlines. Because in the meantime, today, tomorrow, and next week, 7 people a day are dying in British Columbia. And for the minister's information, she doesn't need to take a lot of time working on the terms of reference. They're done in this report. There is a clear roadmap about what needs to take place. This is a matter of life and death. It is a matter of urgency. So today, we are asking this minister to say that she will adopt the recommendations and that before May the 9th, we'll table in this legislature an action plan that meets the recommendation of 30, 60, 90 days provided by the Death Review Panel.
Minister.
Thank you, Mr. Speaker. I appreciate the work of the panel and of the Coroner Service to compile the report. It confirms that the work that we have underway is urgent and vital and absolutely necessary to save lives. The panel found that the primary cause of death was the increased toxicity of the drug supply. I'll remind the chamber again, the 2019 year, the number of overdose deaths fell for the first year since the public health emergency was declared. The first 2 months of 2020, deaths continued to fall and spiked terribly from a 4 to 8% toxicity of fentanyl before the pandemic to, in the last month of 2021, 24 to 28% toxicity. That has outpaced the ability of our government to add services, which we are doing every week. Prohibition doesn't work, and we're tackling that also. All of the measures identified in the panel report are ones that we are working on urgently, and we look forward to the cooperation of all practitioners in this chamber to carry out that work.
Thank you. Member for Caribou-Chilcotin.
Thank you, Mr. Speaker. These are certainly sad and frightening times, to be honest. The people of this province want action on this topic. Since we last discussed this, 7 more British Columbians have perished. The latest death review panel shows that people in my community are not immune, Mr. Speaker, from this opioid crisis. The report highlights that rural and remote areas still face systemic barriers accessing key services. The report cites the following challenges, and I quote, vast distances between communities, small service centres, the harsher climate with poorer transportation systems, remoteness and isolation, and potentially limited social, educational, and employment opportunities, end quote. Mr. Speaker, will the minister commit to delivering a 30, 60, 90-day action plan by May 9th to actually address the systemic barriers that rural communities are facing right now?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. We share the same urgency that is reflected in the coroner's report, in the death panel review report. We know there is more to do, and we are adding new services in all regions of the province almost every week. At the start of the public health emergency, we focused on scaling up expansion of naloxone. We then added in medication-assisted treatment, and later, as the emergency response required, we added registered nurses, the only place in Canada where they're allowed to prescribe medication-assisted treatment. That has got particular benefit for rural and remote areas. We're also working with First Nations Health Authority to build and rebuild 8 different First Nations-led treatment and recovery centres. That's got particular benefit for remote and northern regions. The only province in Canada that I'm aware that is funding directly through the First Nations Health Authority to build facilities, to also work with Indigenous leaders around land-based solutions. In every way, we have modified and expanded our approach, and it has been outpaced by the increased toxicity of the drug supply. I share the member's concern particularly about access and service to rural and remote areas. That's a foundation of our plan, Pathway to Hope, and it's something we're working urgently with Northern Health and with Interior Health every day to implement.
Thank you. Member for Caribou-Chilcotin, supplemental.
Well, thank you very much, Mr. Speaker. I think we've discussed this before. Minister, the current approach is not working, and the results are clear. The North is disproportionately represented in overdose deaths. The 23 public health experts of the death review panel said very clearly that a 30, 60, 90-day action plan is both realistic and urgently needed. The question is, will the minister act urgently as the panel has recommended and meet the May 9th deadline to present an action plan?
Minister.
Thank you, Mr. Speaker. Our government has been acting urgently. We share the urgency that identified in the coroner's reports. The report also correctly notes that one of the impediments to being able to mount a response to this public health emergency has been impeded by the lack of a system of care for mental health and addictions. When we formed government in 2017, it was not in place. We've been acting to fill all of the gaps in the system of care since then. That is not built in a 30, 60, 90-day framework. I wish that it could be. And so we continue to add treatment, overdose prevention, medication-assisted treatment, safe supply, anti-stigma campaigns, applying for decriminalization, working with every health authority. And I'll take this opportunity to give thanks again to the health authorities that are fighting 2 public health emergencies, implementing a system of care, and rolling out an unprecedented immunization campaign. I think all members in the House would recognize we're asking more of our health authorities than we ever have before. And we wish that they could work faster. We are there with them and working together.
Member for Surrey White Rock.
Thank you, Mr. Speaker. I, like many in this House, and many of the families, the 6,007 British Columbians lost their families after the report that we saw yesterday, would have hoped and would have expected this minister to come into this House today and embrace and support the work that was done by this panel and support the recommendations, the key recommendations that are to save lives. 7 people a day. 7 people a day. And one of the key findings from the coroner, a lack of urgency. A lack of urgency. And what we've seen from this minister today is a lack of urgency. And I think those families, British Columbians, deserve better than what they're getting from this minister today. And I will say this, and I think we can all agree, time is of the essence. Yesterday, the Premier committed to work on the terms of reference for the Health Committee. And as the Premier knows, this report from the coroner has specific timelines. Timelines that are put in place to try and...
Please continue.
Timelines that are put in place to try and curb the dramatic numbers, the tragic numbers we are seeing every single month. Can the Premier confirm when the committee will be activated, and will he use the panel's recommendations as terms of reference so we can get to work now, as British Columbians expect, and make sure that we are doing everything we can to support the recommendations that were put out yesterday?
Government House Leader.
Thank you, Honourable Speaker, and I thank the member for his question, and I can confirm for the member that the terms of reference are being worked on, and it is our expectation that they will be tabled. The motion to activate the committee will be tabled on the Monday that we return to this House after the 2-week break.
The bell ends the question period.